Well, obviously, with people looking at having a procedure done, there's many concerns and fears, obviously, that they feel. I just wondered if you could maybe elaborate a little bit on some of the common fears and concerns that patients present to you with, and how you, I guess, give them some comfort around that.
Right. So one of the commonest fears that patients have is not waking up after surgery.
Oh.
And
that would be me too.
Especially if it's the first time that they're going to have anything. But I'll reassure them and tell them that if they've been seen by a qualified surgeon, if they've had appropriate workup before the operation, and if the procedure is done at a well-equipped hospital, and the anaesthetist is a fully qualified anaesthetist, the risks of not waking up is close to zero. So that is really not what I think about. There are lots of other surgical issues that I deal with, but if you're healthy, then rest assured that things are going to be okay.
Yeah.
Another issue that or concern that patients have is that the surgeon may not look after them after the operation, that they obviously see them, they look at the website, they might come across quite well in the first consultation, but they're fearful that afterwards they may not be looked after. So it's very important for patients to research the surgeons, to see what the qualifications are, and also preferably talk to the patients that the surgeons had in the past.
Is that common? Do you find that people will ask you to speak to previous patients?
Some do, and certainly some look at reviews on the net, which is quite useful.
Yeah, definitely.
But word of mouth, I find that it's one of those things that if they know someone who's had the procedure with the surgeon and they're happy, then it's good.
Yeah.
But, you know, from my point of view, if I was a patient, I would want my surgeon to be available after the operation, and if there's any questions, any concerns, I want to be able to reach them.
Yeah.
And that's the service that I provide to patients.
Yeah, sure.